Well, hello and welcome to all of our viewers around the world. I'm Fiona Lang-Sharp, IBCLC Director of Communications and MC here at Gold Learning. Well, we're back with you here today talking about what's coming up at our Gold Midwifery Online Conference 2025. That's right, folks. Here we are in the new year. We're excited and delighted to be part of this educational year. And we want to invite you to head over to the website at goldmidwifery.com to check out all the details of what's coming up. Let me tell you, we are so delighted to have Nell Tharpe back with us here again at Gold Midwifery. And Nell is going to be offering a very special offering this year, a 2-hour presentation. And you might be wondering why, but I'm going to let her get into some of the details in just a moment here. But the title is Mastering the Assessment and Repair of Birth Lacerations. Welcome back, Nell. How are you doing?
Oh, thank you so much, Fiona. I'm doing great, and I am so excited to be able to present this offering at Gold this year.
Yes, absolutely. And I know you're always so busy now. But the truth is when you come to us, your attention to detail and your love of this profession, particularly in this area, is undoubtedly just so precise, and you are an abundant of giving. So thank you so much. This is just a bit of background. I'm just going to tell people that Nell's been working so hard on this, and you are really going to, be able to show up, learn, and apply these skills right away. But let me turn it back over to you, Nell. Could you please just share a little bit with our audience what you are going to be doing in this 2-hour session?
Sure, thanks. Again, Fiona. So my goal is always that people get practical skills. It's important to have the didactic knowledge and the understanding of what you need to do, but more important than that is the ability to actually do it. And so my goal always is to present information that is clinically relevant to the clinician and can be applied in the birth setting to the people that we provide care for. And specifically, my focus is on assessing birth lacerations, so the ability to actually engage with the client before you start looking, and do a thorough examination so nothing gets missed. And based on that examination, make an accurate diagnosis that then you can discuss with your client and figure out what's the best plan of care going forward. And then, of course, lastly, we want every midwife to have stellar skills in performing birth repairs when they are needed. We know they're not needed a lot of the time, but there are those other times where they are so important to the ongoing function, health, and beautiful appearance of people's vulvas. So we want everybody to have the skills they need to feel confident and to provide exemplary care to every single person that they care for at birth.
Yes, absolutely. And what can people, in terms of, you've sort of given us a little bit of expectations, but should we be bringing things? What can we come prepared to do as part of this session?
Great question. So, people can bring instruments and models if they want to work along with me. However, what I'm going to recommend is that everybody owns those things, that they are going to be able to practice for the duration of their career in simulation or practice, but that during the presentation that they actually are focused on the presentation. Because what happens when you try to do it at the same time is inevitably you miss something. So I encourage people to print out the handouts, take notes as you go along, mark where you might want to come back and review, so that when you have your instruments in front of you and you're working on putting the things we've talked about and demonstrated into practice, and you have a question, you can come back to it.
I love that. Yes. And of course, this will be a live session, so people will be able to engage in the chat. We'll also have a live Q&A with you as well, so that we can pick your brain a little bit more afterwards. But knowing that this is recorded really will help. And you've emphasized the importance of sort of staying focused in the moment, but then being able to go back and practice along as you watch the recording. So some great things to build on for skills and those things as well. Now, I want to get into asking you, because I'm always curious to how people really get into what they do and why. You have really honed in on these skills, but tell me, your career spans decades, clinical practice. I'm not going to age you, I promise. But you have worked extensively in this field. What really inspired you to focus in on improving midwives' assessment and suturing skills?
So a number of different things. Care that I received as a birthing person. So that would be part one. Care I did not receive. That would be part two. Care clients of mine received from clinicians other than me before they came to me. Responses that I got from clients who came to me after their births. Um, that really showcase the importance. And then I just have to thank all of the midwives who have come to me over the decades that I have been teaching suturing skills for midwives and brought their questions and their learning experiences. So many midwives have said they don't feel confident in this skill set. And that really has been important to me, both as an educator and a midwife, but also as someone who feels passionate about our profession, that we want to put our best foot forward always. We want to provide exceptional care. That's part of what our mission is in general, to provide exceptional care to birthing people. And so, and my real exposure, I was teaching classes related to cesarean for midwives who assist at cesarean, and that's where I got to see firsthand midwife suturing techniques. And the light bulb went off that, okay, we got a really big range here, and most people have a lot of room for improvement. And my perspective was that of both a midwife and an RN first assistant working in general surgery, OBGYN surgery, orthopedic surgery. So I did this very complex dual practice of both midwifery and assisting in surgery. And I got to see lots of surgeons suture. And so to be able to bring those skills to midwifery just seemed like this unique opportunity to really lift our profession up. And my personal feeling, so you asked the question, you're going to get a mouthful here, is that every client deserves the same quality care, whether they are in a home birth, a birth center, a clinic birth, a small community hospital, a big tertiary care referral center. In the birth room, they should have the same quality care as you would get in a surgical suite. And that has been my mission, to improve midwives' exposure, understanding, and abilities when it comes to suturing.
Oh, I absolutely love that. And I know you're going to be talking about that, some of that during your presentation too. And that it's so valuable to know and hear you say that. It's something that I think everybody desires right across the board, that, equity within birth, particularly in this area. So now tell me, what is coming up for you this year? Because I know you've always got things going on for yourself. So perhaps you can share some of the things you want to highlight that you're doing this year.
Okay, so the thing that's taking the most of my time right now is working on the 7th edition of the Clinical Practice Guidelines for Midwifery and Women's Health. So we're trying to close in on finishing the manuscript and getting it all submitted to the publisher. And I find the work, it's very brain intensive. But what keeps me going is knowing that the book is or has been used in 39 different countries.
Wow.
And so it's an opportunity to improve the care of women and families and reproductive health using a reproductive justice framework. And that keeps me going when the writing gets hard. The other big project that I am working on is a set of clinical competencies for suturing and perineal repair for midwives. So one of the pieces that has been missing, that's been a gap, is actually knowing what the expectations are, or having expectations to teach from as a preceptor or an educator. And so I have taken all of the information I've gotten from people across the years and begun to formulated into a framework that will be easy to use. There will be checklists and there will be objective evaluation tools so that people will actually be evaluated based on objective criteria instead of someone just saying, oh, that's good enough, when the individual might think, but I'm not ready. Or someone saying, no, you're not doing good enough, when in fact, perhaps they are. So I am a big fan of objective criteria. I think there's lots of different ways to teach. I think there's lots of different ways to learn. But I think having very clear expectations about what is the foundation for the work that we're going to do is so very important. So that's my other big project. And there's one more.
There's more, yes.
And I'm working to finalize an online educational project with Rutgers University. That will be a self-directed online education program on suturing and perineal repair for midwives.
Excellent.
So
needed.
That will be and it will be marketed to anybody who wants to take it. It won't just be for Rutgers students.
Right. Oh, that's really nice too. How lovely is that? So giving, again, access to those anywhere, I imagine, in the world that desire and need this as part of their practice. That's wonderful. Where can we also find the updated, the updated version of the practice guidelines, the competencies? Will they all be available soon and online? Where could a person find those things?
Okay, so the clinical practice guidelines are available through most booksellers, like online booksellers. They're also available through the publisher, Jones and Bartlett Learning. I think there's a link to that on my website, which is nelltharpecnm.com. The competencies are still in development, so they will go first to midwifery education programs to trial before publication. So wonderful. We want to have some validation before we go to publication.
So TBD, stay tuned. That's what we need to say.
Everything will be available through my website once it gets to that point. But I will tell you, this is a slow and laborious and detail-oriented process.
Yeah, I can imagine. Well, your dedication again to this area is just admirable. So thank you so much again for all that you do. And, we appreciate, not only it's sort of this global aspect, you really are touching people around the world. And we're very fortunate to have you here at Gold. So you heard it here first, folks. And you will get all the inside scoop with Nell, as well as skill building here at her presentation coming up at our Gold Midwifery Conference. Thank you so much, Nell, for being with us here today.
Always a delight to see you, Fiona. Thank you so much.
Thank you, Nell. And again, quick reminder, you can head over to the website right now to goldmidwifery.com, Mastering the Assessment and Repair of Birth Lacerations with Nell Tharpe. We'll look forward to seeing you online. Check out all the details, time zones, your time, and how you can watch it in the recorded version as well. We'll look forward to seeing everybody online. Thank you for joining me here today. Bye-bye for now, everyone.